Well, good morning, everyone, and a little different time slot for us than normal, but as we have been doing throughout May for Mental Health Awareness Month, trying to continue to bring more content. This is the fourth webinar we've done this month. We'll have our wrap up next week where we kind of cover all the things we're doing focused around workplace mental health and where we think we're going. There is a Q&A box at the top of your screen. You can submit questions at any time throughout today's presentation. We'll get to as many as we can at the end. If you haven't already, please make sure you sign up for emails on our michigan.gov/workplace mental health. That site also includes all of the recordings. It'll have today's recording and other resources and links that are important for the work that we're trying to do. And as you all know, our goal is to provide working people and employers with information about issues impacting our workplace, the impacts to our mental health, and the options for addressing those types of issues. And we always talk about those three pillars that we're looking at, of those things being in the workplace, like what is a workplace issue that's causing chronic stress and leading people to poor health outcomes, anxiety, or depression? What are things affecting the workplace? So we talk about some of the things we'll talk about today that come into the workplace. So poverty, racism, gender discrimination, adverse childhood experiences, things going on in the house, all of that's going to come to work. And we need to be able to manage that. And then individual behavioral health supports, because all of us have a responsibility to take care of ourselves, and we need help to do that sometimes. So we got to make sure people have access to those support mechanisms. And that's really what we focus all of our webinars around. So I talk a lot about systems and structures because I truly believe it's all connected, and we can't turn a blind eye to things that are coming into the workplace, and we cannot ignore things that are being caused by the workplace. So we have to really look at the systems that we use throughout our society to support people's well-being and mental health. And as I often say, I don't have stress buckets, and I can't easily separate the stress that's caused at work from the stress that's caused from home or other obligations that I have. It would be really nice, right, if we did, but it doesn't work that way. In fact, there's a show called Severance where they focus in on severing your stress buckets in essence. And one of those big challenges we all face, and I know I'm facing right now, is that we are caregivers. And for many of us, that can be your children. I'm in that sandwich spot right now, like many are, where it's actually both sides of the spectrum that my parents are getting older. They're still doing okay, but they're slowing down. So there's a lot more obligations going on there, and some people have more difficult circumstances. So this is a really critically important issue that's impacting our workplaces in a big way. And to help us discuss and explore these issues today, we have a fantastic guest, one of my friends, one of all of our friends, who is part of our Michigan commissioner on our Michigan Women's Commission, and also the founder of Mothering Justice, Danielle Atkinson. So we're going to delve into these topics. She's got a couple of guests with her. So for now, I'll turn it over to you, Danielle, and I appreciate it.
Yeah, Sean, thank you so much. I really appreciate that. And I am joined with some amazing people as well who are going to talk about just, caregiving in general. No, there's not a lot of new information about that. I think we are going to have an opportunity to commiserate, to understand better and deeper, and then also, be able to relate to what's going on for other people and then give them resources. So with that, I'd love to introduce Karen and then Mathilde. If you guys would love to just say a little bit about yourself and a caregiving story, that'd be really wonderful.
Hi, can you hear me? Okay, I'm Karen Kavanaugh. Thank you, Danielle, and thank you for inviting me to talk today. I lead strategic initiatives for the Rosalind Carter Institute on Caregivers. We intentionally changed our name a couple of years ago from Caregiving to Caregivers to really center more the person who is providing the care and not so much the tasks, even though those are incredibly important. One caregiver story, and if you don't mind, I'm going to read you a quote from one of my favorite people in this space, someone who is very, very thoughtful, who works at Sloan Kettering and just released a book on caregiving. And it's about, even though she works in this space, it's about her own experience caring for her father. And the reason I'm going to read this quote is because it is one of the least talked about aspects of providing care that can really wear on a person over time, and yet and still it is one of the most meaningful experiences that people derive from providing care. So if you don't mind, I'm just going to read this. I realized during the first or second of what was eventually 20-something ER visits that without me by his side, when my dad was disoriented or too ill to communicate on his own behalf, there was no way for any of these providers to truly know him, to know anything more than what they could physically see of him or read in his medical record. I knew that in those moments, without my conveying to the healthcare team who my dad was in terms of his personality and his drive for life, he could be labeled as yet another 90-something-year-old man with multiple comorbidities and a likely poor prognosis. This label could significantly shape the care he would receive and the trajectory for his life. Without an advocate by his side in those valuable moments, he was at risk for being a passing stranger to the medical team. And this very much can be a component of the experience of caregiving. And so I say that to both center the caregiver as well as what they are doing to preserve the humanity and dignity of the person they are providing care for. And I just want to say that this is Dr. Allison Applebaum, whose father was Stanley Applebaum, who wrote Stand By Me. And so they're white, and she always says that they're very privileged. So think about that for a person who's providing care to their mother who has dementia, who may be a person of color living in a rural area.
Thank you, Karen. Thank you so much. And Mathilde, if you'd like to introduce yourself and share a caregiving story.
Yeah, thank you. Hello, everyone. Thank you for having me. My name is Mathilde Roux. I'm a policy analyst with the U.S. Department of Labor's Women's Bureau, which for those of you who don't know about us, we are a 104-year-old agency and the only agency mandated by Congress to represent the interests of working women. So caregiving has kind of always been a big part of our work. We know that caregiving has historically and continues to disproportionately fall on the shoulders of women. And so their economic security and their ability to work is intricately tied with caregiving and whether they can have caregiving supports. And we see that in our own lives too. My colleagues, everyone kind of has their own caregiving stories. And so as we work to support working women all across the country, we also see the support that we need ourselves in caregiving. And so this topic really hits close to home for all of us. And so I'm very happy to be here with you today.
Yeah, I really appreciate that. And I think, what I want to add about caregiving and my story, I appreciate the name change, and I appreciate the sentiment behind it a lot. For Family Values at Work is a national network that Mothering Justice is involved in, and we're working on paid leave. We often center other people, and so I just want to lift up the caregiving of ourselves and how much we put that on the back burner. I had a Facebook post that I was like, as I get older, the only thing I want for my birthday is a party where my dermatologist, my oncologist, my general physician, maybe my orthopedic could all come together and we could all just talk and divide and conquer a plan, because it's just really taxing physically, making all the appointments, and mentally, and that's just when you're well, right? And so I want us to take a moment and think about our own caregiving of ourselves and to center that in this conversation, as well as we're thinking about the things that we can do to support a caregiver, even when it's ourselves. And Mathilde and Karen did a really great job of just articulating what caregiving and caregivers look like in our society right now. 65 million Americans are caregivers. Most of those are women. The people who are disproportionately represented and disproportionately negatively impacted by caregiving are women of color. We know that approximately 15 million adult family caregivers care for somebody who has Alzheimer's or another form of dementia. 15 million. And then Karen's story really illuminated what it looks like to care for that person. A lot of people described caregiving as a joy, but we know the things that really rob that joy are when a workplace doesn't rise up to support you, when you are not properly in community to get the things you need. So we're going to dive into a discussion about how we can be that, how we could provide that, how we can see when something is a stressor and offer resources. And so we're just going to go into our conversation. And so for my first question, just want to really ask both of you, can we talk a little bit about what it's like to be a caregiver right now? And I'll start with you, Karen.
Sure. So again, I'm happy, Danielle, that you're underscoring both the difficulties and the meaning and the joy, and the effects of providing care, which are significant with respect to adverse health outcomes, financial outcomes, mental health outcomes. Although I do like to underscore that don't want to pathologize how people respond to providing care within an environment that is incredibly unsupportive. And one of the biggest pieces of that is that we don't really have a coherent, high quality, affordable, long-term care system in the United States. And so many families are out there just trying to cobbling it together for themselves. So I'm going to give you some takeaways from a recent focus group. We did 3 focus groups with caregivers as part of our profiles in caregiving experiences work. So the first one is that often people who are providing care are doing so for more than one person and have had the experience more than once in their lifetime. And that's really where they are developing the skills, is because they're doing it again and again. They report that caregiving is quite isolating and lonely. There is chronic stress and strain associated with the experience. They do not feel that the system is very supportive, and again, attempting to navigate that system is a really significant component of the stress and the strain. Some report that they feel that employers understand but don't really know what to do to support them. And of course, this is very dependent on where somebody works, the occupational category, and the industry sector. There's a lot of uncertainty also connected with the experience, which adds to the strain. And then we have found that there's about 3 major components that really characterize the experience. One is the stage or phase of the care. Has someone had a catastrophic accident and overnight you are a caregiver because their mobility has entirely changed? Are you midway through a cancer diagnosis where the prognosis is uncertain, or are you at the end of life? That really matters, and transitions matter. Again, the particular strains also shape the experience. And finally, really importantly, the goals of the dyad, so the caregiver and the care recipient, really shape the experience. And those goals can be aligned or not. And then outside of that, of course, are all the other factors that we talk about and label as contextual factors: race, ethnicity, where you live, rural community, suburban community, urban community, and family. So I'll stop there.
Thank you. And Sean, are we at 45 or? Because I thought we were starting at 15, so I just want to make sure where we are so we can get questions in if possible.
Got about 10 more minutes for discussion, and then we'll do 5 or so for Q&A.
Perfect. Okay. Matilda, would you like to talk about where we are with caregiving right now?
Yeah, thank you. And I want to talk about unpaid caregivers, but I also want to talk about paid caregivers. So to start with unpaid family caregivers, right now, the primary federal policy that's available is the Family and Medical Leave Act, or FMLA. I hope everyone who's watching is aware of it, but in case you're not, it provides covered employees with up to 12 weeks of unpaid job-protected time off to care for themselves, a loved one, or a new child, or attend to certain military family needs. And that job protection is a really critical component of the FMLA and really has helped a lot of people be able to take the time that they need to do that caregiving. The FMLA turned 30 last year, and it was an incredible accomplishment, but it's really just a first step. We know that there's still a lot of workers who are not covered by FMLA or who just can't afford to take that leave because it's unpaid. And access to paid leave is not equitable. Some workers, women, workers of color, low-wage workers are much less likely to have access to paid leave. And they're also often the least able to afford to take unpaid time off. So over the past 20 years, we've seen states across the nation create paid family and medical leave. We're now up to 13 in DC, and these programs are really life-changing for workers in those states. And we continue to focus on advancing paid leave so that more and more workers can be covered under state laws. And then I want to talk about the paid care workforce because that's also disproportionately women, and they are really, really important. Often people receive care from both paid and unpaid caregivers. Those really work hand in hand. And we really can't talk about access to paid care without talking about the care workforce. And right now there's a paradox in the care economy that even though care work is in high demand and out of reach financially for many families, professional care workers are paid a median of less than $15 an hour. So that's not a family sustaining job. And so while they're vital jobs, they're not always good jobs. But we also know that lowering the price of care cannot mean lowering the wages of care workers. So we really have to think about investing in care and the care workforce to really meet the needs of care that we have right now. And then the last group I want to talk about among care workers is domestic workers. They're really critical in helping unpaid caregivers continue to be employed by providing care in the home and kind of working together. And some on the call may be working as care workers, as domestic workers, or be employers of domestic workers. And so I want to highlight a resource that the Department of Labor put out, which are sample employment agreements to help employers of domestic workers and domestic workers themselves as a starting point to discuss a shared understanding of the terms of employment. And so those sample agreements are available on our website in multiple languages, and we hope they can be helpful for folks.
Thank you. We have so much more to cover, but I want to make sure that we leave room for questions. So I wanted to combine kind of what Karen was talking about and Matilda when talking about what we can do. So I'm going to move into a question, Karen and Matilda, about how we can relieve the burden. But, you know, speaking to what Karen was talking about with different types of phases of caregiving and different demands and needs, you know, we have paid sick days for, oh my gosh, my son just fell and broke his leg. I've got to take him to the emergency room. Family medical leave for a longer illness or diagnosis or welcoming a child, and the fact paired that with FMLA not being paid, right? And the stratification of people who need the benefit. So it's really important to understand where somebody is in their caregiving journey, what thing they're addressing, and whether or not there is the right workplace supports for that. Having a general PTO policy doesn't necessarily address like, oh, my father unexpectedly died. And then we're talking about bereavement. I think we lost Karen and Sean. But, so that is, they're off camera. So that is different, and we need to be considerate of whether or not people have those workplace supports. And if they don't, what does that mean for their mental health? And so the last question, really want to talk about what are the things we can do right now to relieve the burden of caregiving? Oh, I'll go to you, Matilde, and then Karen.
Thank you. So at the Women's Bureau, we focus a lot on outreach and education because we know that there are resources available, but a lot of folks, unfortunately, are not aware of them. So I think that's something that's really important for us to make sure that working caregivers are aware of things like the Family and Medical Leave Act or their state paid leave laws, whether that's family and medical leave or sick leave or others. And then also other policies and protections that are available. Anti-discrimination protections for nursing mothers, for pregnant workers. Those are all really important. And then, we also really emphasize the role that employers can play in supporting working caregivers. This is kind of a shared responsibility for all of us, and employers can help by providing paid leave and other caregiving supports like childcare and long-term care assistance. And as you mentioned, really lack of support has an impact on mental health of caregivers. And so the department has put out some resources related to mental health that I hope can be useful for folks. Our Office of Disability Employment Policy offers a number of resources on mental health, all available on their website, including a guide on fostering a mentally healthy workplace and other resources for workers. I encourage you to check those out. We've also seen a lot of action in the Biden-Harris administration around the maternal health crisis, which includes both physical and mental health. And so, again, action around protections and accommodations for pregnant workers and new parents. And the U.S. Department of Health and Human Services has made available a national maternal mental health hotline that's available 24/7 in English and Spanish. So I want to make sure that folks are aware of that and know how to access it. You can call or text. The phone number is 1-833-TLC-MAMA or 1-833-852-6262.
Thank you. And Karen?
Yeah, thank you. So everything that Matilde just said, and then I'm going to briefly describe how we are engaging employers with a bit of a carrot strategy. So it's a little bit different. And I'm so happy to tell you that Michigan is leading. We have just concluded our first innovation lab with 5 employers in Michigan. And we brought them along through about a year's process to really deepen their understanding about this cohort of the workforce, talk to them about what they were seeing. All of them came to this process understanding that they needed to do more for employee caregivers, but they just didn't know what. The state of the evidence in this area is that we don't have great evidence to say to employers, if you implement policy A, outcome B and C will ensue. It's not that their supports are not effective. It's just we don't have enough evidence yet, and we need that in order to move employers. So we are convening employers, really appealing to their self-interest on recruitment, retention, and to help them devise solutions to implement within their workforce and then pilot and test. And so we're very interested in small and medium-sized organizations where workflow cannot be done remotely. These are really the employees and employers we want to help to sort of solve for. So the very interesting pilot that these employers came up with is, number one, they're going to look at their own benefits and really sort of crosswalk what could be helpful to an employee caregiver and what are the barriers to using those supports. They are going to if they don't already have an employee resource group, think about setting one up, but we always say, please do not set one up or do not survey your employees about this unless you are going to do something about this, unless you are committed to that, to listening. But they are going to share 4 or 5, we're calling them navigators, actual human beings who would be available to talk to an employee caregiver and really understand where are they, what is their particular situation, and what are their most important needs right now. They are going to connect them internally to benefits that may be helpful, and then externally to benefits and services in that broader community. And while we think this will be a very important support for employee caregivers, not the least of which it will signal to them that employers care, because narrative change is really, really important. But we do hypothesize that what we will find is that there's not always services that are available or affordable to navigate them to. And so our longer term theory of change here is that we really want to engage employers more in being more vocal and visible advocates for change. We always say they can do more to support their employee caregivers, but they cannot solve for all of the issues that derive from such a fragmented, dysfunctional system. We really need significant public policy reform in this area, including federal policy on paid family and medical leave. I will stop there.
Yeah. So, Sean, I don't know if you can see the box. If there's any questions, we would be happy to take them, but also want to continue the conversation. Would love to partner with Leo. If there's anyone who wants to do a small group conversation with Karen, volunteering Matilde and I in my mothering justice capacity to think about this. Obviously, we believe that there needs to be public policy change, but also the work that's happening that Karen is leading, and then the resources that Matilda talked about. We need to lean into those as just education and opportunities for narrative change and innovation.
For sure. I love it, and love the discussion too. I think when we talk about public policy change, since we're all in Michigan, we don't have to wait for the federal government to do it, right? We can do it at state level, and we're seeing a lot of states start to do this. New York recently passed a law to actually give paid breaks to nursing mothers. That's not, there's reasonable stuff and all this kind of interesting language in the federal law. They're tightening that stuff up. I think this first question might be more of a statement than anything else, probably for Matilde. Somebody in the Q&A asked about the wait time if you're denied FMLA for filing an appeal, being more than a year. I don't know that you need to answer that question necessarily, but I think there's definitely challenges with the Family Medical Leave Act. And if you are denied, theoretically, you either avoided using it for whatever you needed it for, or you might have lost your job because you did take time and it wasn't considered protected. So that appeal can be challenging. Matilde, you got anything to add to that?
Yeah, I would just say, it's really important that folks file complaints if they think that they have been denied FMLA improperly, and that they get in touch with the Department of Labor's Wage and Hour Division about that, because the Wage and Hour Division does conduct investigations, and we really need to know kind of where there are issues so that we can address them. So just that word of encouragement.
Yeah, just for everybody's awareness, it's changed a little bit now because we've added jobs and all that kind of stuff, but roughly half of Michigan workforce is under 50 or less employees. So they're not covered by the Family Medical Leave Act. So there's a big hole for Michigan workers when it comes to that. I love that we talk so much about what work employers can do. That's what we're here to do. I do want to share a caregiving story and talk about, we talked a little bit about how caregivers need to take care of themselves. And I heard this story about a young person was in college, family member had a debilitating medical trauma, and they had to leave school and they've spent the rest of their time, the last 20 years, taking care of this person. And I can see as a caregiver, you hear about it when you're caring for somebody with dementia, but I could see where this person might have a lot of resentment and, anger and a lot, because their whole trajectory changed based on one outcome. Like, is there anything we can tell a caregiver like that? Any thoughts from any of you?
I mean, and I'll definitely throw it to Karen, but at Mothering Justice, as we are an employer who employ a lot of caregivers, a lot of caregivers, just leaving space, just even when we and this is a small thing, but when everybody was dropping their children off at college, that time, it's like the same weekend or whatever, the Monday following, people were sad, moms were sad, and just leaving space for that and not having a random intro question and be like, you know what, we're just going to hold space for the sadness. We're going to hold space for the job that you have outside of this job. It goes a really long way in just recognizing someone's entire humanity. And Karen, do you have anything?
Yeah, I would absolutely echo that, Danielle. And I think Shauna's great question. And I would say that allowing for and making space for those feelings of anger and resentment and envy it is really, really important. Normalizing those come right beside joy and meaning. That this is life, and we tend to compartmentalize way too much in our culture, but prioritize and award feelings of joy and laughter and that sort of thing, and so really making the space for those types of feelings, and also they're normal. They're normal. Most caregivers have those as well. And then I would say, really, of course, digging in to find out what are the concrete material things we can do to help this person. And again, I would say if we had a stronger, high quality, long-term care system in this country, perhaps that person would not have had to leave school. Maybe there would have been other changes, but not to have to leave entirely.
I would just add, hopefully that person's watching. Thank you. That's a huge commitment from you, and you've actually committed yourself so much to someone else that you should be commended for that. I think it's hard. You are going through mental health stress, so don't do it alone. I was told my son when he was growing up, this wasn't related to any caregiving, but if you're in a hole, stop digging, right? You need help to get out of the hole. So don't stigma be damned. Find help, get help, understand that these feelings are natural, they're normal, you're going through stress, and people are here for you, but thank you for doing that. We're a little bit over, but we have two great questions. We have a couple that we probably won't get to. I apologize to everybody. Two of them focused in on sort of resources. So one is, if someone has developed a substance abuse problem from the stressors of caregiving, are there any resources we would direct them to? Kind of, certainly I would chime in with get help, get the therapist, do what you can do. Sometimes it's hard. I understand that. There are community mental health resources. If you go to michigan.gov, I think under our individual tab, there are some links to other types of resources that are available, but any thoughts from anybody on the call?
Yeah, I don't, people sometimes have access to saving plans and the resources. People don't necessarily know about the resources, especially when you're in a hole, that your employer offers. So making it a regular communications about those things and the mental health services, like some people don't know that they have particularly low copays for mental health services. So just just continuously making it just a standard operating practice, because you don't want to stigmatize things either, right? So just continue and be like, hey, does everybody know? Like we have obviously weekly calls, but monthly, at least monthly, we're talking about the benefits that people have, and making sure that people are taking their time off. Because even when people have access to time off, they have a fear of taking it around, oh, if I'm not here, I'm not needed, and people will think that I'm not doing a job. So continuously reminding people of the benefits that they do have.
Awesome. So one of the remaining questions was about connections to resources. So you talked about that webinar, or are there other places that people can land to understand more what benefits are out there? This one was related to caregivers that might need help with transportation or something like that.
Depending on who the care recipient is, the Area Agency on Aging has resources. If it's somebody with a cancer diagnosis, the American Cancer Society has resources. If there's a disability, some of the disability organizations also have resources. And I know I'm saying these things, with the irony that this is exactly what I don't want to be doing. I don't like sending people to a website or even a telephone number, even though that's what we have at times. So if it's within the workplace, again, having someone who knows where these resources are and can actually do the navigation for the person, that could be very, very helpful.
Okay. Well, we're about 6 minutes over, and I appreciate the conversation. So good. We would definitely take you up, Danielle, on kind of continuing the partnership and potentially circling back to these conversations. But just Karen, Matilda, and Danielle, thank you so much for joining us today. A lot of interest in caregiving, a lot of great questions were coming in. Sorry to everybody if we couldn't get to those, but appreciate you all so much for joining us today.